Hello and welcome to another remote edition of Currently in Quincy. I'm Joe Catalano. On today's program, we will chat with Manatt Community Health Center CEO Cynthia Sierra and their Chief Medical Officer, Dr. Lily Young. First, though, we check out the news for you this morning. Quincy Public School officials are waiting for guidance from state education officials about how to handle the remainder of the school year now that Governor Baker has announced that schools will not reopen for the rest of the school year. Superintendent Rick DeCristofaro says decisions about grading, report cards, graduations, and other year-end activities will be coming soon. The school committee will meet virtually next Wednesday. In the meantime, online learning will continue through June 17th, and grab-and-go meals and learning enrichment packets will continue to be offered weekdays from 11 a.m. to noon at both high schools, as well as the Snug Harbor, Lincoln Hancock, Clifford Marshall, Parker, Atherton Howe, and Montclair schools. Quincy College will not hold a graduation ceremony this year, and all of their classes will remain online for the rest of this semester and throughout the summer. Now, the college hopes to allow students back onto campus in the fall. College is also offering $300 discounts for their online classes to Quincy and Plymouth residents and $150 discounts to all other students. Quincy Mayor Thomas Koch says there will be no Memorial Day parade this year and that the annual Flag Day parade is doubtful. Koch says it would not be possible to maintain safe social distancing during those well-attended events. He says a small Memorial Day ceremony may be held at Mount Wollaston Cemetery. The annual Cleaner, Greener Quincy and Senior Olympics have also been postponed indefinitely. Well, a Quincy nurse who went from treating patients with COVID-19 on the front lines at Brigham and Women's Hospital to fighting for her life against the virus had a hero's welcome home yesterday. Debbie Bonapane has spent the past week battling the disease and was escorted back to her Rhoda Street home in Howes Neck by a parade of first responders and well-wishers from the neighborhood. Bonapane is also a breast cancer survivor, a Navy veteran, a single mom, and a volunteer first responder every year at the Boston Marathon. She is a Dorchester native now living in Quincy. Everyone maintained their social distancing during yesterday's homecoming, as she may still be COVID-19 positive. However, the entire community wanted to welcome her home. Bonapane needs 2 negative COVID-19 tests before she can return to work, which she says she can't wait to do. An anonymous woman has been buying pizzas for Quincy's first responders, known as the Quincy Pizza Bandit. The woman has purchased at least $600 worth of pizzas so far from Rags Tavern in Quincy Point and had them delivered to Quincy police officers, firefighters, and Brewster ambulance workers. Now, at last check, the woman had paid for 75 bar-style pizzas to be delivered anonymously to emergency personnel. And workers at Rags Tavern say it makes their day when they're able to deliver the pizzas to workers on the front lines of the coronavirus pandemic. When we return, Cynthia Sierra and Dr. Lily Young of Manatt Community Health Center describe how the health center is helping out during the pandemic. That's next.
As we work to get through these times together, you may not be thinking about blood donation, but blood is needed to save the lives of people who are sick with a range of illnesses. It's easy and safe to give. If you are in good health, please donate. We need heroes now. Visit redcrossblood.org to schedule an appointment.
There will be parties again soon, and family gatherings. There will be parades, and sporting events, and concerts. To help our communities when they come back together, respond to the 2020 census now. Spend a few minutes online today to impact the next 10 years of healthcare, infrastructure, and education. Go to 2020census.gov and respond today to make America's tomorrow brighter. It's time to shape our future.
Pleased to welcome to the program Manatt Community Health Center CEO Cynthia Sierra and Chief Medical Officer Dr. Lily Young to bring us up to date on how the health center is coping with the COVID-19 crisis and how it might impact folks here in the community. So Cynthia and Doctor, first of all, nice to see you both, and Doctor, nice to meet you.
It's a pleasure to be here and to have Lily as Chief Medical Officer on this journey, if you will, in our response to COVID-19. Joe, was great and an amazing, and as so many say, unprecedented time for all of us. But we're comforted by the opportunity to spend some time with you and provide an update on the health center. But I think importantly on how we can help serve as health educators and keeping our shared community safe, and the city of Quincy that we're so proud to be in. We always have been, Joe, as you know, for over 40 years. But this is a time like no other, and to see the camaraderie amongst organizations, the camaraderie, of course, that's always been there with the city of Quincy, the mayor and his staff, our commissioner, Ruth Jones, just an extraordinary time. And I think there's a few key principles to that, and partnership and collaboration and communication. So I acknowledge you, Joe, as part of an important information team and local media that's truly helping to spread the word and to keep us safe. So we are strong and well at the health center, and happy to be serving in both in primary care and behavioral health. And testing and screening, and Dr. Young will speak to that. And I think it's important for us to be able to share that what has been a profound honor for us, Joe, during this time is to not only see the strength of the community, the strength of partnerships, the strength in each other, the strength in this amazing staff that we have the pleasure to work with, our colleagues on this team, but also the ability as a community health center to spread beyond, if you will, the walls of our health center, to extend ourselves out into the community, to be there for folks and cohorts and affinity groups that need us, in addition to our own patients, if you will, community residents that are in need of health education, comfort and screening around COVID, and symptom management. And all of that truly, Joe, made possible by the staff and the talent here. Donors that are supporting us with a box of masks, if you will, cookies and snacks, if you will, healthy snacks, of course, Joe,
of course,
for our staff, right? And our mayor and our delegation members, both state and federal as well. Just a truly remarkable time and team effort. But it's so important that folks have the information that they need, and so a true partnership with Dr. Young and Joe, I'd love her to be able to inform and speak to your audience on how we're responding clinically, but also how to keep residents in the city of Quincy, if you will, COVID healthy, and what they should know that they may not know about COVID. And if they know it, I feel like it always bears repeating, Joe. So I hope that's a good opening for us, and then I'll turn this back to you, Joe, and to Dr. Young.
Thank you, Cynthia. Thank you for your kind words. I do appreciate that. So, Doctor, if you could, just by way of introduction, tell us a little bit about your background and how you got to be Chief Medical Officer at Manatt.
So I have been a doctor for almost 20 years. I graduated from Boston Medical Center. I started part-time here for Manatt at the Quincy Medical Site. My clinic moved here about, 6 years ago when the hospital suddenly closed. I am an internist by heart, but now I'm a pandemic doctor apparently also. I speak Chinese, so we service a lot of Chinese patients here. I have a great team of 25 providers, many nurses and medical assistants, and also support staff that are multilingual, serving our broad community here in the South Shore. We go as far down as Taunton, all the way out to the peninsulas of Hull and Hasneck and Snug Harbor. So that's my background. Since March, we've changed our focus a little bit.
Yes.
To better serve our community for the pandemic. I have a really talented team of an infectious disease doctor, Dr. Toledo, and an occupational health specialist, Dr. Yang. And together, the three of us have read probably 100 different protocols from hospitals, community health centers, from multiple different states and countries. And we put together an algorithm for MANET. We are here to serve our 17,000 plus patients. We're serving our first responders. We are helping with the local communities in terms of the senior housing and the nursing homes. We have a rigorous protocol. We are not quite screening everybody yet. If you are asymptomatic, we are still advising that you self-quarantine for 14 days with exposure. And if you become symptomatic, or if you have any type of exposure and you fit the guideline for testing, we will put you through our drive-through tent that has been in existence for 3 weeks now. It is a giant tent that fits 3 cars driving in on one side for testing. We have a core group of staff working there. We do a lot of, so we call the patient first to get the history, and then we give them a time to drive through the tent, and then they come through, they get their vitals taken, and then they get swabbed, and then we give them a very well-prepared 4-page document to check your symptoms, to how to self-quarantine for yourself, how to self-quarantine for your family, and also what to look for in terms of symptoms. Sometimes reading is too much. One of our pages is cartoon characters so that they know what type of symptoms to look for. In addition, that's for our patients. We also have a very rigorous algorithm for our employees to keep our employees safe, and also to screen them for testing or whatever's necessary for this COVID-19.
How many patients have you tested, doctor, and how many have tested positive right now?
So we have tested about, I think it's 700 plus people, and we have a 16% positivity rate in terms of testing. We've tested as young as 3 years old and as old as 90 years old coming through the tent.
Really, what is the youngest and oldest that have tested positive?
3 years old is the youngest positive.
Wow.
The oldest positive is not 90.
Okay.
I believe it's in the 70s.
Okay. And are you actually treating patients there with COVID-19?
So we don't treat our patients actually on site. Most of our patients, fortunately, are their symptoms are not severe enough to be admitted to the hospital. So in our protocol, we do, after testing, we do a daily symptom check. Pretty much, whether you're positive or negative, we do almost daily symptom checks up to day 14. Because what we've learned from the hospitals is that a lot of the outpatient docs are sending the patients in too late to the hospital, or the symptoms are too severe. So we've developed our protocols to monitor so that we can be aware of when the symptoms are getting worse, so that we know when to send them in early.
Okay. If someone is not a MANET patient but doesn't have a primary care physician, are you able to help them?
Absolutely.
Okay.
They just need to call our front desk, get registered. They get triaged by a core group of nurses in our Corona team, and they will put them through the tent for testing.
Okay.
And they will also get the same symptom follow-up after.
So, I mean, you are quite literally on the front lines of this pandemic. We've heard stories about shortages of the personal protective equipment, a shortage of testing swabs. Is that an issue at Manat?
Yes and no. We go through days of worry where we need gowns and N95 masks for our frontline testers. The N95s are specially tested and fitted by size so that there's no aerosol leakage. We're still short on N95 smalls. It was Christmas today. I got a shipment of waterproof gowns from our suppliers.
Very good.
So we'll be good for a week there. I also got a shipment of testing swabs. So we'll be good for probably another week there also.
Okay. You know, we've heard such tragic stories about this virus really taking hold in nursing homes and senior living facilities, long-term care facilities. Are you seeing that in Quincy as well?
So we're definitely seeing the fear. We've done here at Manat a very aggressive approach of screening and telephone screening in one of the Quincy high rises. So we've called and sent out notices to almost 270 patients in that building, screening them for symptoms, seeing if they need any extra help right now with the fear and anxiety, if they needed to connect with our behavioral health team, if they needed medications sent to the house, if they needed to see their doctor, or if they needed food delivery. We have been able to connect patients with resources.
That's great.
Aggressive screening approach. We've been able to schedule some patients in for their follow-up with their doctor. We've given a lot of reassurance to those patients. So we've done that screening. Some of them have called us to come get screened. Our drive-through is open. On rainy days, we pull the tent inside because it's just really too cold and rainy and windy outside.
Sure. Cynthia, I should ask you, as you're well aware, of course, the governor just announced yesterday additional assistance for community health centers when it comes to testing kits. So will Manat be a beneficiary of that?
Yes. So I think along with PPE, as you mentioned, testing kits and supplies have been in short demand, but we received a wonderful call in advance of the governor's press release yesterday from our laboratory partner who has responded in kind. And what we're not concerned about at this time, Joe, is access to testing supplies and all of the tools, if you need that the tools, if you will, that Lily and the clinical team need. If I could, I wanted to speak a little bit, Joe, about some helpful messages to keep community members safe,
Please.
but also about telehealth. So Lily oversees a team of primary care physicians. We also have behavioral health providers and social workers, and we also have nurse case managers and addiction medicine providers and nurses. And so here at the health center, if a patient does need to come in for in-person care, they, along with any guest or employee, goes through a screening process at the front door that includes a temperature check, right? Because there are some cohorts of patients that just need to be seen for whatever those clinical reasons are. So we still need to make sure that we're making sure that our sites are as safe as they can be, and the folks that enter have that sense of confidence. But telehealth is a model that so many groups have been able to convert to successfully. And so whether it's a telephone call or ideally through Zoom, we're able to connect with our patients. And it's important to say that because we want to be able to make sure that we're responding to our patients. And even if they need support around behavioral health, and we actually have a group that's up and running through our behavioral health team, frankly inspired by a patient on how to manage isolation, in a sense of some mild depression as an example through this period of time. But I think in terms of messages that bear repeating, so for us in the health center, and certainly Commissioner Jones issued that order, the mask is really important, right? And keeping that distance.
Right.
And so we do mask here at the health center.
Okay.
We mask when we're out and about. We can't say enough about it. Lily referenced N95 respirator masks, and those are exclusively for care providers. But for all of us, this or some type of covering is really, truly important and a great safeguard.
Okay.
Maintaining that distance of 6 feet. We really encourage fresh air, opening a window, if you will. Also, what's really important, and we have some hygiene fact sheets, hand sanitizer, and good old dish soap is tremendously important because it helps to break down the lipids in the virus, and even within our own homes, just making sure that we're keeping our surfaces clean in our kitchens and in our living rooms with a light spray that has a bleach content, and know that the greatest safeguard that we have truly is these items here, right? So very, very important. But really the work that Lily and the team do, educating before someone has a test, but also what happens when someone goes home after they have a test, and how they work with their family and maybe segregate to the best of their ability. You referenced nursing homes, skilled nursing facilities, and why there's a dense concentration. It also comes to mind with folks that live in apartments or folks that might live in public housing communities or are homeless. And why they may be more susceptible, Joe, is because they don't have the ability to socially distance from one another. Right. They're living in close quarters. They're sharing laundromats, if you will. They're sharing hallways. They're sharing recreational areas. So as hard as it is for residents that are living in those environments and those facilities, to really respect that guidance that says, to not gather, to not take guests and visitors in. We know that it's hard for our homeless populations in Massachusetts. I mean, we've learned the importance of being able to create space inside of shelter environments. So we feel like we're not doing our duty to you and your viewers today, Joe, if we don't remind and perseverate the reminders of those messages, and also to try to be hopeful that there is a pathway to prevent COVID, and we're doing all that we can here. Lily referenced the tent. It is open 6 days. It's really important to call us, have a screening, make that appointment. I think a wonderful team to sort of guide folks through that tent, and so it's a wonderful partnership, frankly, here with the city to make sure that everyone that needs that access to not just the tenting service, but also the support and the symptom management on the other side of their test. It happens.
Sure. The testing site, I know, is at the West Quantum Street location. Is it any other locations also that are testing?
So for Manat, that's our only testing site.
Okay.
Our Taunton patients can go to Morton Hospital for direct testing.
Okay, very good. Doctor, how do you kind of, envision this pandemic playing out in the weeks and months ahead? Do you have kind of a long-term vision, I guess, for how you'd like to see it play out?
Oh, that's a very good question. Not one I'm sure I can answer. Yeah. I think we have such smart people in this world, and today we started antibody testing on a lot of our patients coming through the tent. I'm hoping a vaccine and will soon be developed, and hopefully medicines that truly work on this virus will soon be found.
Yeah. I mean, obviously it's nothing that any of us have ever seen before in our lifetimes. So from a professional standpoint, did you ever think you'd be dealing with something like this?
That answer is definitely no.
Yeah. How do you think it'll prepare you for, your future career going forward?
I'm going to tell you, I love primary care. I love to see my patients in person. Yeah. Like to give them a handshake or a hug, and it's really hard right now. Yeah, I am sure. Anything else you'd like to let our viewers know? So I just want to reiterate what Cynthia said, because this whole term of flattening the curve is truly really important, okay? Being masked outside, washing your hands on the inside. We give very good guidance on how to sort of self-isolate if you have multiple family members in one apartment with one shared bathroom, how to wipe things down so that you reduce the risk of exposing your other family members. And I think watch out for your symptoms, okay? The symptoms of COVID are different than the flu, okay? They're a little bit different, but they're a lot different in many ways also. The acute symptoms, fever, a dry cough, shortness of breath. Some people have loss of sense or smell. Some people have backaches. Some people have stomach symptoms, okay? But I think being aware that that's different than a few days ago and seeing where did you go or who did you contact or who came into your contact that could have potentially brought in the virus, okay? We ask all those questions to the patients that come in. I know it's hard to get thermometers out there, but if you have one at home, it's good to have. Make sure it's working, okay? And I think keeping yourself healthy, get enough rest, drink enough water. There's a lot of stuff to watch on TV and the news. Maybe if it makes you anxious, maybe not watch it.
Or limit it at least, right? Yeah.
Correct.
Sure.
I think we would just want to add, Joe,
Yes, please.
also how important it is to call your primary care provider, to call if you have any questions. I know that our community hospital partners feel the same as they see a diminishment in their emergency department activity. I mean, health centers really are shock absorbers. We want our community hospitals to be able to, on ICU and inpatient units, be able to accept patients that are sick with COVID. So call if you have any questions. We know that it's a fearful time. We know that folks are concerned about entering health facilities. You know, it's important to know that the rate of transmission is actually lower inside of healthcare facilities, and that's truly because of how pure and clean we keep our environments and the protection and the infectious controls that are in place here. So that's our message as well. Please don't hesitate to pick up the phone, whether it's your community health center, whether it's your primary care group, or whether it's your local hospital. So we're here, and we appreciate your time, Joe.
Of course. What's a good number to contact Manet at, Cynthia?
Absolutely. 617-376-3000. And again, 6 days a week, we're here providing services and also doing the work.
Okay.
They have an opportunity to reach an on-call provider 24 hours a day.
That's great. And I know manetchc.org is your main website. And I know you also have, you mentioned folks with substance use disorder. I know there's some virtual resources available for those folks as well.
There's actually a lot of resources that since the pandemic has started for a lot of patients. We have a very robust medication-assisted program that is doing telehealth. We still have a very active prevention team. We have a very active pharmacy team that's able to convert a lot of our patients' prescriptions from 1 month to 3 months so that they don't have to come out to the pharmacy as much. Our case management team is still very active in seeing patients, and our behavioral health team also is very active in seeing patients.
Right. Just a critical service also right now for a lot of folks. Yeah. So, Dr. and Cynthia, I want to thank you both very much. Really appreciate your time. And if we can be any other assistance here at QATV, please reach out, and we'll make a connection to the community for you.
Thank you, Joseph.
Thank you.
Stay healthy.
Thank you. You as well. Bye-bye. Special thanks to Cynthia Sierra and Dr. Lily Young of Manet Community Health Center for joining us today. Thanks to our crew working remotely from home. And thank you for watching. A reminder, please send us your videos of your life during the coronavirus crisis, and we will show them on Quincy Access Television Channel 8. Just email your submissions to covid19@qatv.org. For all of us here at Quincy Access Television, I'm Joe Catalano. Please stay safe.